morning, everyone. At the outset, I would like to thank AIOS for giving me an opportunity to present my paper on the topic Subconjunctival triamcinolone in phacoemulsification, a novel dropless approach. What is dropless? Cataract surgeons are always in the search of ways to refine the surgical procedure, improve the result, and at the same time prevent untoward complication and enhance patient satisfaction. One of the contemporary drug administration method is a dropless approach, wherein no topical drops are administered post-operatively. It can be accomplished in a number of ways, where intracameral injection of antibiotic and long-acting corticosteroid, intracameral injection of antibiotic and subconjunctival injection of corticosteroid, and translunar injection of intracameral antibiotic and corticosteroid. These are the references. What is the drawback of conventional regimen? Conventional regimen are given for 4 to 6 weeks post-operatively, and it offers very excellent and predictable outcome. But it has certain drawbacks like long and often difficult to follow schedule, non-compliance, particularly in uneducated and rural population, failure to follow asepsis, and incorrect dosage. Also, topical medication itself have inherent issues like corneal toxicity, therapy cost, and all these can lead to undue complications. Why dropless? Benefit to the patient: topical drops free post-operative period, cost benefit to the patient, and no compliance issues. And benefit to the surgeon: no need to worry about the patients wrongly using the eye drops or using eye drops of lower quality, and simplified post-operative follow-up. In this study, we had total of 100 eyes of 100 patients, and which were further grouped as follows. In group A, they were given perioperative antibiotic and steroid with no drugs in the post-operative period, and in control, they were followed up the conventional topical post-operative regimen. In the inclusion criteria, primary senile cataract and patient willing to consent and follow up. These were the exclusion criteria. Now method. Phacoemulsification with IOL implantation was performed by a single surgeon using similar technique in all cases. In the study group, after IOL implantation, intracameral injection of antibiotic, moxifloxacin, and subconjunctival injection of steroid, triamcinolone acetonide is administered. No eye drop is prescribed post-operatively. Now, post-operative assessment of following parameter were done on day 1, 3, and weekly till 6 weeks of visual acuity, intraocular pressure, any sign of infection or inflammation, compliance issue, patient satisfaction, and size of subconjunctival depot was recorded using sirtuximab group A. And the result of the clinical characteristics of the patient were similar. There was no significant difference in both the groups. And IOP was recorded and compared. There was no significant difference in both the groups. Only on the day 1, which was due to the closure of the chamber at the higher pressure. This is the graphical representation of the IOP. In the anterior chamber cells there was no significant difference between both the group. Only we can see that in the study group there were lesser number of the patients which were having cells as compared to the control group which were using topical drops. The visual acuity was in all the patients were less than 6.9 and 6.6, and which was significant. There was no difference in both the group. Size of the subconjunctival steroid was recorded in the study group, and it came to be it decreased in all the group in all the patient, and only in one patient it was there at the day 42. This is the clinical photograph of the patient having subconjunctival depot, and at the day 42 we can see that it has all resolved. All patients in the study group were satisfied with the dropless regimen. 31 patients were willing to opt for the same in the surgery for the other eye. 19 patients who were pseudophakic in the other eye were more satisfied with the dropless regimen. Few females had cosmetic problem related to report, but they were concerned about that. Conclusion. The dropless cataract surgery regimen appears to be safe and effective technique. It is becoming more and more popular as it avoids a lot of issues faced by the patient in the post-operative period, post-operative inflammation, compliance, ocular surface disturbance, and financial burden of therapy. It may be extremely useful, particularly in the Indian setup. However, a large randomized control trial is needed to standardize it.